In our community, we can raise awareness for the risk factors of an overdose, learn the signs of an overdose, and know the steps to take to effectively help someone. Opioids are dangerous drugs, but by coming together as a community, we can save lives.
Some common examples of prescription opioids include morphine, hydrocodone, and oxycodone, as well as illegal opioids such as heroin and fentanyl. Understanding the risk factors for an overdose are crucial, such as change in tolerance. This occurs when a person does not use opioids for a period of time due to incarceration, treatment, or sobriety, leading the individual to accidentally take too much. Combining substances such as benzodiazepines or alcohol can also increase the risk of overdose. Changes in purity. The drug landscape is always changing. Fentanyl is an extremely potent opioid and is increasingly being mixed into substances without someone knowing it's there. Individuals who previously overdosed are also at higher risk for experiencing another overdose in the future. And lastly, using alone. When alone, no one is available to call for help if an overdose occurs.
When the body is exposed to too many opioids, an overdose occurs. When Narcan is administered in time, it restores our body's ability to breathe. That's why it's important to recognize the signs of an overdose and respond swiftly. These signs include unusual sleepiness or the inability to wake a person, slow or snoring breaths, pale and clammy skin with dusky lips, pinpoint pupils, and a slow heart rate. It's important to note that Narcan is safe to use even when the individual is experiencing a different medical emergency. It cannot be abused, and it is not addictive.
When responding to an overdose, the following steps may occur at once as time is crucial. First, call 911. Then determine if the scene is safe and kneel next to the person. Attempt to get the individual's response by performing a sternum rub, by rubbing your knuckles firmly up and down the breastbone or yelling their name. If no response is observed, administer Narcan, also known as naloxone. Allow 2 to 3 minutes for the Narcan to work and remain with the individual until help arrives.
To use Narcan, tilt the individual's head back while supporting their neck. Insert the tip of the applicator into the person's nose. Press firmly on the plunger with your thumb to administer the full dose of Narcan. You will want to watch for individuals' color and breathing to improve and their overall responsiveness to increase. If after 2 to 3 minutes there are no positive changes and you have another dose of Narcan, administer that dose. If the individual's heart is not beating, Narcan will not be able to effectively reach the brain. To help with this, start by doing chest compressions immediately after. To do this, place the palm of your hand on the center of the individual's chest, place your hand on top, and press hard and fast. If you feel comfortable, you can provide rescue breaths as well. To give rescue breaths, simply pinch their nose and cover their mouth completely, giving your breath over 1 second. Maintain a ratio of 2 breaths to 30 compressions. If you are uncomfortable providing rescue breaths, hands-only CPR or chest compressions are acceptable and a life-saving practice. Continue this process until help arrives.
The individual's condition may improve or they may need to be transported to the hospital. The effects of Narcan are temporary, lasting 30 to 90 minutes, which means overdose symptoms may return after the Narcan wears off. This is one reason it is so important to call 911. After administering Narcan, an individual may be confused or agitated and experience withdrawal symptoms, such as body aches. Try to keep the individual calm, encourage them to not take more opioids, and stay with them until medical help arrives.
By knowing the risk factors, recognizing the signs of an overdose, and knowing how to help,
We can all save a life.
Narcan is available at various locations. Check with a pharmacy or local Narcan Direct site, such as the Fond du Lac County Health Department. Some programs offer it at no cost to you.
Carry hope.
Carry Narcan.
Save a life.